And welcome back to Public Report. I'm here now with Dr. John Tipton, and he's going to be speaking to us today about sports injuries. Welcome to the show.
Thank you. Thank you.
Could you tell us a little bit about yourself and how you got involved with sports medicine and sports injuries?
Sure. I'm a family physician that had an interest in sports, so I did a sports medicine fellowship in primary care at Moses Cone here in Greensboro for a year, and now I'm doing sports medicine and family practice at Cornerstone.
And what was your interest in sports? Where did you grow up playing sports?
I did, yes. I was a wrestler all 4 years and had musculoskeletal injuries, just the same, torn cartilage and all that, and had a repair, and my interest grew from there. Yeah.
And now that summer's out and all of the kids are, playing and going to the pool and, getting involved in a lot more sports since they have time out of school, what would you say are the most common injuries that you see?
A lot of the injuries that come into our office are usually sprains and strains, bumps and bruises of that sort. So yeah, and they'll come in because they're hurting for more than just a day. So.
And what's the difference between a strain and a sprain?
Well, a strain is usually muscle, and a sprain is usually ligaments around the knee or the ankle, that sort.
And someone probably couldn't figure that out on their own. They would probably have to come into a physician's office to find that out.
Right, right.
Okay. Do you see any kind of injuries that are maybe more common in adults than children?
Yeah, well, in children, I see a lot of sprains and strains, and also I see that in adults. But in children in particular, I see growth plate injuries. The children are still growing, they still have growth plates, and growth plates are where the bones get longer, you see injuries there because they're inherently weaker than tendon. So you see a lot of that. Now in adults, you see a lot of overuse injuries, meaning like tendinitis or stress fractures. And that's probably because a lot of adults have the perfectionist type of attitude. They're type A personalities. They want to keep on doing what they're doing. Play sports despite the injuries that they have. Other than the overuse injuries, I also see a lot of strains in the adults. As adults, we become less resilient and agile. So, a lot of adults come in because they're weekend warriors, and they come in, they didn't properly warm up and get injuries that way. So.
Well, speaking of warming up, what would you suggest for adults to kind of prevent some of these injuries that they have?
Well, like I said, proper warm-up, so that means stretching and also getting your muscles slightly warm before you do the full contact physical play that they do on the weekend. The other thing is wearing properly fitted equipment. That's important. If you're playing football, say, make sure the helmet is fitted properly. It's not loose. Properly fitting shoes. Know proper technique in your sport. I think you could reduce the amount of injuries if you know the proper technique, such as in tennis. Don't be the weekend warrior. I think you need to maintain a moderate amount of fitness throughout the week so that you don't get these injuries during the weekends. And I think the most important thing for adults, too, is learn and accept the limitations of your body. So, and don't go over that. I mean, if you know your body's hurting, don't keep on doing it. So those are the main things that I tell my patients to do.
Now, when you warm up, I've also heard that for some sports that you should also stretch afterwards. Is that true?
Yeah, that's true. Your muscles are warmer that way. And when you stop doing the sport, they start to contract more. So just a gentle stretch would help your body recover faster. So.
And do you think that regular exercise is a way to maybe also help prevent this, or do you think it's just because of maybe, you know, adults are kind of exerting themselves a little more?
Yes, regular exercise is important. Like I said, maintaining the moderate exercise throughout the week will help prevent injuries occurring in the future. It's just a good, you know, and instead of focusing on one specific exercise, I think getting a total body workout is important. So you work out your heart, your muscles, your lungs as well.
Would you say that maybe running is a good way to kind of get that full body workout?
It is. It is. It's very good.
Maybe also too swimming now that it's the summertime.
I encourage swimming for those who can't run. If the pounding on their body is a little too hard, you know, low impact aerobics such as swimming or biking are a great way to get some exercise. And then plus you work out muscles that you never knew you had in swimming. So.
'Cause isn't that the sport that uses the most muscles?
I would think so, yeah.
Okay. And, you know, I grew up playing a lot of sports, and I also saw a lot of concussions. Thankfully, I never had one, but I know a lot of people who did have one.
Right.
So is this as common as I believe it is?
Oh, it's getting more common because people are becoming more educated. They're knowing the symptoms and signs of it, and it's being reported more. And I think just, you know, from experience, my own experience, kids and people nowadays are getting bigger and faster, so they're getting hit harder, and so that's contributing to the higher incidence of concussion in today's sport.
So when you say concussion, is that just a head-on-head injury, or what exactly is that?
Not necessarily. A concussion is a form of brain injury that you usually can't see it.
Okay.
And it's a result of either a direct blow to the head or an indirect blow to the head. And what I mean by indirect is that a blow can be placed anywhere on your body, such as your chest, and that force of that blow is transmitted to your head. So, yeah.
And do you see that it's more common in certain sports over others?
Yeah. Those, especially football, those collision sports, high collision, high velocity sports, are where concussion is most prevalent. Soccer is another one. You know, people are running and then they're heading the ball, so you expect to see that. And possibly baseball too. If they get dinged in the head in the right place, they'll probably get that too.
And would you say that women are just as susceptible as men are, or do you see more cases in men?
As far as concussion goes, I think that's half and half. I think more men usually are coming in with concussions. I see, in my practice at least, I see more men with concussions, but it can go either way. Of course, there's no football in women's sports, so you know, less high velocity, high contact sports in that respect.
So what should someone do if they think that they maybe have one or have had a concussion? What should they do?
I think the first thing is stop play.
Okay.
And seek medical attention right away, specifically with somebody who's knowledgeable about concussions and knows how to treat them. And you know, you just want to be smart. You want to not do any activities and shut the body down until the symptoms go away, and that includes getting enough rest for your mind and body. So no watching TV, no reading, no listening to loud music, just complete rest until the symptoms go away.
And what should someone do if maybe they're playing, you know, maybe flag football or something where there, you know, isn't necessarily someone watching over them that could give them that medical attention? You know, maybe they're just playing in their neighborhood or, you know, in a grass field. What should they do if someone, you know, maybe hits them really hard and gets maybe a concussion?
I think they need to be honest with themselves. Like I said before, know your limits and accept those limits of the body. So if you know you don't feel right, let your friends around you know and seek that medical attention.
And if the people around them say, you know, we need to take some action here because we think you do have a concussion, should they go to a physician such as yourself or the emergency room?
It depends on where they are. If the emergency room is the fastest and quickest way to get medical attention, that's probably a good thing. Especially if they have any neurological deficits, definitely go to the emergency room, because that way they have some life-saving equipment they can institute there.
Okay, and when you say neurological deficits, what exactly does that entail?
So it entails loss of bodily function. You can't use your arm. You slur your speech. If you look in somebody's eyes, somebody's pupil is a lot larger than the other.
Okay.
That sort of thing. And they can't look, you know, they don't recognize you, those sort of things.
So those are pretty noticeable things.
Absolutely, yeah. And so, and if you see any of those, I would suggest going to the emergency room right away, where they have the equipment to treat you.
And if someone has questions maybe about an injury that they've had, then how could they get in contact with you?
Well, we have a website, www.cornerstonehealthcare.com, and also our number. Hopefully, they'll post that on.
Mm-hmm.
You know, so and they can get in contact with us anytime.
Would you say that concussions have a long-term effect on the body, or do they have more of a short-term effect?
The majority of the times, it's a short-term effect.
Okay.
The majority of cases, the symptoms go away in a week. But there's a certain few that last more than a week, and those needed to be looked at on a more regular basis.
Okay.
So.
And out of curiosity, I know growing up, again, you know, I did play a lot of sports, and you know, sometimes women got different injuries than men did. Is that true for adults, that maybe men get certain injuries and women maybe lean towards a different kind of injury?
As far as what type of injury, the women actually in today's sport, they're 3 to 7 times more likely. Actually, it's 3 to 7 times more prevalent that they have ACL knee injuries, or what I mean by ACL is the anterior cruciate ligament. And there's several factors that's the reason for it. It's because women in general, their knees are more, they have more laxity in them, so there's more give there. And that could, you know, there's several factors that cause that too, is maybe hormonal, is what some studies have shown. One of the other reasons is that their knee mechanics are different than guys. So.
Well, I thank you so much, Dr. John Tipton, for coming and sharing this information.
Sure.
Thank you, viewers, for watching another edition of Public Report. Have a great day.